Hey everyone, it's me Marie. I'm back. This is gonna be my cervical cerclage video. Give me a second. Come on. He just wants to touch the keyboard or whatever. And we're not gonna do that, huh? Say hi everyone. Say hello. Say hello to everyone. Yeah. Okay. Alright, so this is gonna be my cervical cerclage video. I'm sorry I didn't do it a couple of days ago, but I wasn't feeling too good. Yeah, I'm sorry I look like a hot mess too. I've been cleaning the house, dusting the house. I just been by myself because my boyfriend's been doing 12-hour shifts, so I've been also taking care of Valley by myself. Yeah, pretty much. So sorry to look like a hot mess. Alright, so I'm gonna go ahead and again this is the information that my doctor has given me, and also information from the American Pregnancy Association. Both are the same. They both have questions and answers and stuff like that. So I'm just gonna read it off the link because I can't find it right now. Alright, so first question is, what is a cervical cerclage? Treatment for a cervical incontinence is a surgical procedure called cervical cerclage, in which the cervix is sewn closed during pregnancy. The cervix is the lowest part of the uterus and extends into the vagina. Of course. Next question, why is a cervical cerclage used? A cervical cerclage procedure may be used if a woman's cervix is at risk of opening under the pressure of the growing pregnancy. Or a weak cervix may be a result of a history of a second trimester, a previous cone biopsy or LEEP procedure, damaged cervix by pregnancy termination, basically an abortion. So those are the things that may cause a weak cervix. That may lead you to have a cervical cerclage. Next question. When is a cervical cerclage used? The best time for a cervical cerclage procedure is in the third month, between weeks 12 and 14 of pregnancy. However, some women may need a cerclage placed later on in pregnancy, and this is known as an emergent cerclage, and is necessary after changes such as an opening. Such as opening or shortening of the cervix have already begun. If the emergent cerclage is required, future pregnancy may also require cerclage. Next question. What are the alternatives to a cervical cerclage procedure? If changes in the cervix are found very late in the pregnancy alternative. Found very late in pregnancy, or if the cervix has already opened up significantly, bed rest may be an alternative. So if you're like 30 weeks and it starts opening, then you need to go on bed rest. Or if it's open a whole lot, basically they're gonna try to just put you on bed rest as long as possible, pretty much. Come on, Papa. Wait a minute. Ooh, you're gonna flash everybody. Come on, sit like a big boy. Okay, I'm sorry. Next question. What are the benefits for cervical cerclage? Cervical cerclage helps prevent miscarriages or preterm labor caused by cervical incontinence. The procedure is successful in 85 to 90% of cases. Cervical cerclages appear to be effective when true cervical incontinence exists, but unfortunately the diagnosis of cervical incontinence is very difficult and can be inaccurate. I don't see how that's difficult because all you gotta do is just check, basically. Anyways, that's another thing. I'll have my little discussion after this, like I normally would. Okay, why doesn't every woman who has had preterm baby need a cerclage? Okay, only women with an abnormal or incontinent cervix can be helped by a cerclage. However, even with the help of a cerclage, the other problems can cause labor to begin too early. Women who have a cerclage placed will need to be checked routinely or other complications, such as an infection or preterm labor. I'll read that again. Why doesn't every woman who has had a preterm baby need a cerclage? Only women with an abnormal or complex cervix can be helped by a cerclage. However, even with the help of a cerclage, other problems can cause labor to begin too early. Women who have a cerclage page will need to be checked routinely, or other complications such as an infection and preterm labor could occur. Okay. Um, so basically, what that's saying is the people who have preterm labor, but doesn't necessarily have to do anything with the cervix, because your membranes can break and burst. A rupture of the membranes, like that has nothing to do with the cervix. Sometimes you can get an infection and it could just rupture. That's what they thought. They thought that I had happened to me at first. That's what they kind of said to me. But she was like, really, that's not. She said, I can't say that 100%, but that's what she thought personally. So basically, that's the other things that could cause preterm labor other than the cervix. Okay, next question. What happens during the cervical cerclage procedure? Most women have general spinal or epidural anesthesia for pain control. During the procedure, a doctor will stitch a band with strong thread around the cervix, and the thread will be tightened to hold the cervix firmly closed. Okay, next question. What can I expect after the procedure? You may stay in the hospital for a few hours or overnight, be monitored for preterm contraction or labor. Labor. Um, Immediately after the procedure, you may experience some light bleeding and mild cramping, which should stop after a few days. This may be followed by increased thick vaginal discharge, which may continue for the remainder of the pregnancy. Yes. You may receive medication to prevent infection or preterm labor. For 2 to 3 days after the procedure, plan to relax at home and avoid any extra activities. Your doctor will discuss with you when would be appropriate for to resume regular activities. Your doctor will I read that already. Abstinence from sexual intercourse is often recommended for 1 week before, or at least 1 week after procedure, or none at all. So, I wouldn't advise sex. I know it's hard, but I wouldn't advise it. Okay, how long is this is the next question. How long is the stitch left in for? Generally, the thread is removed at 37 weeks of pregnancy, but it can be removed before if a woman's water breaks or contraction starts. Most stitches are removed in the doctor's office without any problems. The procedure is similar to having a pap smear, and it may cause some slight bleeding. Oh, Papa, you tired? What are the risks of having a cerclage placed? The likelihood of risks occurring is very minimal, and most health professionals feel a cerclage is a life-saving procedure that overweighs the possible risks involved. Possible risks could include premature contraction, cervical dystocia, which is the inability of the cervix to dilate normally in the course of labor, rupture of the membrane, cervical infection, cervical laceration, and labor happens before the cerclage is removed. Some risks is associated with general anesthesia, including vomiting and nausea. Peace proof is life-saving. Okay, next question. What are the signs I should look for after the cerclage is placed that indicates a problem? Contraction or cramping, lower abdominal or back pain that comes and goes like labor pains, vaginal bleeding, a fever over 100 Fahrenheit or 37.8 C's, or chills, nausea and vomiting, foul smell vaginal discharge, the water breaks or leaks. Last questions. What about future pregnancies? Most women who need a cerclage in one pregnancy will need to have a cerclage placed in future pregnancies. So that's all the questions and answers, I'm going to stop this video and make a little short version.